Next, we're going to have our debate. 24-year-old Division I senior football player, obviously from the SEC if he's 24 and a senior, with acute turf toe with the SEC championship 6 weeks away.
Thanks, Marty. And I'm going to take the stance of non-operative treatment. So when we look at the anatomy of the MTP joint, the dorsal hood is the weakest stabilizer of the joint. The plantar plate has an extremely stout attachment that almost looks like meniscal material and attaches to the sesamoid and to the phalanx. Now, while this is the typical mechanism of foot placing equinas and an axial load, someone falls on the foot, I've actually seen some linemen can you take that back one slide, please? Some linemen push off aggressively and actually rupture their plantar plate. So we see all kinds of injury mechanisms here. So in the NFL, Bob and I okay, thank you. In the NFL, we've kept injury and surveillance techniques for the last 30 years. We kept statistics. It's entered by trainers, and so we really know what's happened there over the last 20 years, and many of the things that we've worked on are based on our experience there. And what I would tell you that over about a 7-year period, when we look at how many of these are really complete, like grade 3 turf toe injuries, there aren't very many. Then you add the collegiate ranks that add a few, and the high school ranks that add a few. But in fact, the ones that are sort of sprains, that are low-grade turf toe injuries, don't come to surgery. So we're looking at a very small group of people, and in this debate, we don't really know what the grade of it is. But it is a sprain of the metatarsophalangeal joint, and it's this kind of shoe that gets us into trouble. The stiffer the shoe, the more protection there is. And of course, lineman shoes are much, much stiffer. And so when we look at our criteria or classification, a grade 1 is a stretch or a sprain, grade 2 is a partial tear, then a grade 3 is a complete disruption of the capsular ligamentous complex, or there's the sesamoids, one of the sesamoids, or both, as Bob talked about. And then I add a grade 4, which is an articular crush injury. And when we look at these patients, there's acute onset of MTP joint pain and swelling over 24 hours. And what you have to do is you have to really look at the deformity. As we talked about earlier, where's the ecchymosis, where's the swelling? You can't miss this injury. When they come in, you know they've got a significant metatarsophalangeal joint injury. So I just did this sawbones to just talk about really the exam itself. It's kind of a big one because it's the show to a jury. And I was defending this guy with taking care of a turf toe injury, and so I had Velcro and everything, and I'm showing, okay, so here's the Velcro at the end, and when that's detached, you get a huge drawer test. And I think even the most erudite a jury person can understand exactly what happens when that rips off and you don't have that restraining power in the joint itself, and then you get a complete turf toe there. So here's our drawer, and that's what Bob showed. And if we move on to actually clinically, this is actually a policeman in the Boise Police Force, and you can see he's extremely unstable himself. He was in the canine patrol, and I think his dog started to attack him, and he took off very quickly and ruptured. The dog did not fall on him. He actually pushed off and ruptured. So when we talk about grade 1, grade 2, grade 3 is a complete disruption of the capsular ligamentous complex, and you don't really know. You're going to certainly check them out, see where their pain is, see if you feel a defect, and do a drawer test as well. As Bob also mentioned, we see disruptions medially where we'll get valgus, and we get disruptions laterally where we get varus, and you must be cognizant of this. These are just partial tears, but they certainly can drift with time. Injuries that are going to get surgery for sure are something like this, where you see a complete disruption and diastasis and subluxation or dislocation. So when we're talking a debate here, we're not debating this. This person obviously needs to be treated as well. And grade 4 is my criteria for just a crush injury, and the ball game's really over. And I want to show you this case. This is a receiver playing for the Miami Dolphins, and this was the case that I was involved in for the defense, and we magged this up to show this injury. I just want you to keep watching. It's really sickening. He's still, and he really lays the tip of his toe on top of his foot, and that crushed his joint, and he really never recovered from that as far as his football career was concerned. We talk about retraction of the sesamoids, and that's what you have to show your patients, because that means there's obviously a complete disruption. But this is a 21-year-old linebacker playing his senior year in Boise State, This is probably in September, and he has a dorsiflexion injury, pushing off, non-contact, swollen, painful first MTP joint. These are his initial radiographs, and these are his x-rays at 1 week. They didn't change after that, and I explained to him that what he probably needed was a repair. He said, I've waited all this year all my career for this chance. I've got a chance to go to a big bowl game. I've got a job with an accounting firm when I graduate. I'm going to treat this conservatively, and he did, and he actually, as a lineman, he did fine. You certainly want to image this to see what you've got, and that was a partial tear. It did not obviously progress from there, and he obviously scarred in. So if we're talking about a grade 1 or grade 2 tear, we're going to actually, a grade 1 is going to continue to play, and a grade 2 is going to return to play when his pain subsides, and we use these kinds of things that Bob talked about. We use all the things to bring them along, and when they can cut, and then they can return to contact sports. In my review of the literature, the average time from an injury to surgical repair of a turf toe is 72 days. So 6 weeks is 42 days, and my notion is very few people get to play in a championship game, whether it's high school or college or nationally. I'd educate him, I'd protect his foot, I'd rehab it, and I'd let him play. Our goal in the NFL has been to try to decrease these injuries, and Bob and I have worked on trying to move this curve to the left. You see this is a not as flexible a shoe, and if you can move that stiffness of that shoe with that curve to the left so that instead of the purple line, it's the dotted purple line, so the average dorsiflexion is only 60 degrees, you'll almost remove all turf toes from occurring. So that's our goal, is to stiffen shoes in these players. So this is what we want to change from that what's on the right to that's what's on the left. And just to hold the shoe companies accountable, in the next couple of years, we're going to have RFID trackers in all these shoes, and so when somebody gets a turf toe injury or any other injury, we can tell whose shoe it was and what model it was. Thank you.